I was just about to start my doctorate and was going to focus my doctorate on trans health needs in the United States, looking at health policy for trans populations in the United States. That was my plan. And then I came back to Ghana, and so many things were new and so many things remained the same. But one of the things that was new to me and eye-opening was hearing on the radio anti-LGBT, very homophobic rhetoric by different media personalities. That brought my attention to the question of what it is like for LGBTQ Ghanaians to live every day and survive every day in Ghana, given this kind of violent rhetoric that, even as terrible as things were in the United States, was not something you would commonly hear on the media, right? It doesn't mean it didn't exist, but it wasn't that so explicit and in your face. So I became interested, and I shifted my focus of my doctorate on that very question, right? What's life like? And so that's how I became more directly involved in that question for Ghanaians, LGBT rights, social cultural beliefs about it, what day-to-day life is like, what health access is like. For me, as a public health researcher, that was always kind of one of the main outcomes I was interested in. What are the laws? What are the other structural factors that are shaping people's lives? And how does that impact people's health outcomes? So that's how I became involved. And through that process, I got to meet activists, community organizers who were doing work around LGBT rights and health in Ghana at the time. At that time, there was one main organization that was doing the work. So 2010 is when I became interested. 2011 is when I actively started kind of reaching out and building relationships with activists.